pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Dwayne?
Father, as we gather together as the County Commission, be with us today and guide us in our decisions for our community and for our employees this morning. We also ask, Lord, that you be with those who suffered the devastation from the hurricanes. Guide them and help them through this part of their tragic life. We also ask, Lord, that you continue to bless this region with moisture. We could always use it. In Jesus' name, amen.
Amen. Amen. Thank you. Good morning. No particular chair comments this morning, so we're going to head right into the agenda unless there's any changes to the agenda, board members, that you would like to make. We're going to go with it as published. So first thing on the agenda is consent agenda items, and it's the routine things mostly, and I would ask for a motion to approve those items.
Mr. Chairman, I'd offer a motion to accept the consent agenda as published.
And is there a second to the motion?
Second.
Seconded by Bob. All in favor of approving the consent agenda items, please say aye.
Aye.
All opposed, nay. Motion passes. Next is public comment, and I know we have at least one or a couple of people here for a public comment, and so Doug, if you guys want to come forward first, and then if there are others, then have them speak as well.
Good morning.
Morning.
Good to see you all.
And for the people out in the virtual world, please state name, who you're representing, and
Yeah, that makes sense. It's Doug Keller and Trent Speck with Iron Insurance, and we wanted to come in. I wanted to introduce Trent. Trent and I are going to be working on the insurance moving forward, and I wanted him to come in, and so you guys had a name with a face, and so with that in mind, I'll let Trent introduce himself, and if you have any questions, let us know.
Yeah, I'm Trent Speck, and I'm kind of from Garden City originally. Grew up in Plains after that, moved away, but came back and taught at Holcomb and then taught in the Garden City School District, and had a change of heart, change of career, and instead of helping students, I wanted to help people with their insurance. So met Doug and through a mutual friend contact, and anyways, long story short, I'm with Iron Insurance, but been blessed to been under Doug as a mentor. So doing the insurance, so we just want to do a great job for you guys. We have Aaron Birch out of Salina as account manager. It's kind of switched through our merger last October, actually a year and 2 days ago. Megan is going to take over that kind of going forward, and then Doug and me are going to take over from Sean Myers. Sean moved to Wichita and said that he needed it to be local, so Doug and myself are going to work through. With a lot of changes in Iron Insurance, what we're going to do is we have this calendar that we set up to make sure that the communication between our bigger accounts, such as a county and Iron Insurance, is taking place. And so we have a 5-part kind of calendar, and coming up in the next 2 to 3 weeks, maybe at the start of November, is what you call the loss analysis. And what that is just seeing all the losses and see how we can put a plan in place just to mitigate that and make sure that we're ahead of claims, such as not necessarily work comp, but just general liability and issues pertaining to that. So, and then it's just, as you guys can see, a process. But another one I wanted to highlight was annual stewardship. Like I said, communication is really important between, us and our clients, but especially with the county. So what the annual stewardship is where, we meet with our team and just kind of go through a process, and kind of we rate ourselves, and then the county rates us to see if we're doing a good job. And it's kind of just making sure that we're doing our job when it comes to performance and different resources that we're providing for the county and making sure that, you know, claims are kept to, you can't eliminate all of them, but we do our part to make sure that we have a plan in place for that. So we thank you for your business and thank you for your time.
Appreciate that.
Yep.
Thank you.
Thank you.
Have a good
Thank
day.
you, Trent and Doug. Appreciate that. Are there any other comments from the public for things that are not on our agenda today? Okay, seeing none. Next, we have on the agenda the City of Holcomb, the neighborhood revitalization that we talked about and we tabled from last time. And Robin is here from the City of Holcomb. And then also, I think we might have some comments from our council with regard to that as well. But Robin, if you want to lead off.
Well, again, it was, like you said, it's tabled, and so we are just trying to determine how to move forward on that. Hopefully, what we are requesting is the approval of the neighborhood revitalization plan retroactive to the expiration date of the previous plan. And then just to be allowed to work out the logistics of what that looks like for that one property where we have to figure out whether that's what the rebate looks like for that one customer. But the other two plans, if we could just get it approved, I think we'll be able to work those out easily because one is not completed yet. The second one is completed, but it completed earlier this year, so.
Okay. And then when we did table that, we did so because we asked our council to do some additional research, and so I will turn to Linda at this point.
Thank you. My understanding is that the statute doesn't specifically preclude it, but it also doesn't anticipate it. Meaning what we're doing is probably outside of the box. That said, my further understanding is that the big impact for us as a county would be having to backdate from a different tax year. But based on the projects that are going on in Holcomb, it sounds like the rebates will happen. We will not have to backdate those rebates, if that makes sense, because of the tax year they were completed in. So I don't think the impact on the county is going to be what we were concerned might happen. So I think my short advice is that it's certainly not contemplated by the statute, but it's not precluded. It's not a hardship on the county to retroactively approve this. So that's where I'm coming at it from. So I think it should be fine if the commissioner wants to do that. Obviously, we don't want to make a habit of that, and I'm sure this wasn't what anybody anticipated or wanted.
And Robin, is your understanding in line with what Linda's understanding is?
Yes, what I was gonna add is that was what our city attorney came up with as well. It wasn't specifically prohibited, but it's just a really, really gray area. And I think the one issue that made it a little bit hesitant for everyone is the one property that was completed. And I think Robert had a good suggestion of maybe just adding a year to the end of it instead of trying to do that. But I think it's something that we could work out with Dory and Trista to figure out how exactly to handle that one property. But
And Robert,
it was very
excuse me,
confusing, sorry.
I'm sorry.
I was just gonna add again that Bill Heidman, our city attorney, was having a hard time finding anything specific on it as well.
So Robert, do you have any additional comments to what's been said?
My understanding is that Dory looked into the timing of the completion of that project. It was completed this year, correct? Or
Just that it was not on our NRP list for 2021 taxes. So the first year it would be eligible for a rebate would be 2022. And that is what comes over from the appraiser's office based on their appraisal and review of the project itself.
so that being the case, then we would not need to extend it at the back end because we'll be able to pick it up now.
Correct, it would have, their first rebate would have been for the 22 tax year.
So we can still fit it in there
Okay.
without extending the
Okay.
time.
So it appears everybody who's commented, correct me if I'm wrong, but it appears that there's no harm to the county for us approving this to be backdated to November of 2021. Am I correct on that? So with that understanding, what is the board's desire regarding this neighborhood revitalization plan?
Oh, Mr. Chairman, I'll make the motion that we approve this RHID
And back,
NRP.
this is an
Too many
NRP
acronyms.
to be backdated to November of 2021. There is a motion. Is there a second?
I'll second.
Seconded by Dave. Any further discussion or questions? Yeah, go ahead, Bob.
In the documents we had in the alternatives we were offered, we're talking neighborhood revitalization, and in the alternatives, we're talking RHID. I just want to make sure that we're talking neighborhood revitalization.
Correct. The RHID.
We're not doing both at the same time.
Right, it got a little confusing, I apologize for that. In the memo, they were kind of commingled, but the RHID was simply for us to make you aware that we are applying for an RHID on two areas that need developed.
But
The
not
NRP.
in this motion.
Right, the NRP requires board action, RHID does not unless you oppose it.
Okay, thank you.
Mr. Chairman?
Yeah.
I have a question for clarification. Our duty as a county commissioner, as I understand it, is to make sure that the county is not adversely harmed financially. And I don't see that this harms us, and so, to me, it's a no-brainer. Prove it and get them moving on down the road.
Yeah, we had two questions, if there was going to be any harm to the county, and then whether the statute prohibited the backdating, and we've had clarification on both of those. Yes. Any other comments, Dwayne, any? All in favor of the motion, please say aye.
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 All opposed, nay. Motion passes.
Thank you.
Robin, move forward.
Your time.
Thank you. Appreciate you being here a couple times. Kelly, it looks like we've got you on for the rest of the morning. No, not quite, but. So we'll start with the 2023 employee benefits.
Yes. This morning, Jayla Miller with IMA and myself will be presenting the 2023 benefit renewals and the recommended changes for your consideration. For those online, Jayla is joining via Teams this morning. And just some background for the other commissioners that weren't present. On August 18th, IMA did present in person our 2023 Blue Cross Medical and Dental renewal. This was presented to the directors, the commission chair, Lon Pishney, and the vice chair, Larry Jones. Today, Jayla will share the renewal. She'll answer any questions you may have on how the plan's running and her recommendation for 23. Morning, Jayla.
Good morning, and I am only seeing a black screen. I don't know if that's what I should be seeing, but just wanted to point that out.
That's the best part of us, Jayla, is black.
Incognito.
No, I don't believe that for a minute. All right, I can see you all now. Good morning, commissioners. How are we today?
Good.
Doing great.
Good. All right. Well, as Kelly mentioned, I'm here to present the 2023 renewal. We have the slide deck that I've presented. Do you all have that in your packet?
They do have that, Jayla, and we also are getting it up on the screen.
Perfect. Let me know when you're ready.
Okay, Jayla.
Did you say we were ready?
Yes, ma'am.
Okay, perfect. All right. Well, I'm going to start on page 2. It is titled 2023 Renewal Summary. And starting at the top of the page, just to give you a high-level overview, and then we'll walk through each line of coverage individually. But the Blue Cross Blue Shield self-insured renewal came in at an overall increase this year. Your packet does show 40.6%, but I do want to correct that to be 41.5%. This increase is due to continued high utilization. If you recall last year, as we discussed the renewal, the county hit ag last year, which is the maximum potential liability on the healthcare claims, and we are seeing some increased utilization. This number wasn't a surprise to Robert and Kelly, as we've been kind of setting the stage for this type of renewal increase all year. And Blue Cross is expecting continued high utilization. The total dollar increase then is $1,660,622. So that's the total overall cost. When we break down the three parts of your self-funded contract, Blue Cross Blue Shield is keeping administrative cost flat for this year. That's part of a 3-year rate guarantee that they put in place last year. On your stop loss premiums, we're seeing a projected increase of 34.4%. Last year, there were several stop loss hits, meaning people that have had over $125,000 in claims, and we're expecting another higher number of individuals to hit that stop loss number. This number is also dependent on how the Blue Cross Blue Shield stop loss pool is running. And this year, across our book of business, we're seeing double-digit increases for several of our clients. So that is, again, how the Blue Cross Blue Shield pool is running. And then, as we've talked about continued higher utilization, then we are seeing an increase on maximum claims at around 32.4%. We're focusing on maximum claims this year, as this is where Robert and Kelly have instructed us to set their budget so that we can plan for worst case scenario moving forward. We also have the Blue Cross Blue Shield dental renewal, and it is an increase, although slight, 0.4%, and that's a total dollar increase of 724%. At the request of Robert and Kelly, the county asked us to run contribution illustrations and set the budget, keeping employee contributions the same. Last year, for those that were on the bench, if you recall, we made a couple of changes and raised contributions on employees. And so this year we wanted to give them a break and not raise the contributions for this year. We also have the voluntary vision renewal that Kelly will review with you. It was an initial increase of 14.5%. We went back to VSP and negotiated an enhanced dual option, so giving employees choice on their vision plan. And based on an assumption of 20% migration, we see that to be an estimated increase of 3.8%. This is a voluntary benefit that is paid 100% by employees. We also marketed FSA administration and the Employee Assistance Program for this year, and we will review those further in the presentation. Any initial questions on the summary?
I don't think so, Jayla. Let's
Okay.
continue on.
All right, great. On page 3, I outlines all of the different options that we reviewed from Blue Cross Blue Shield. All of these costs are based on maximum. It is our recommended option to renew as is, no changes to plan design, and that would be that 41.5%. We did look at an option 2, where we would add the qualified high deductible health plan. However, because of your partnership with GrowWell, there are some compliance concerns with having employees contribute to an HSA and receive first dollar health care at the clinic. And so that's an IRS regulation that just can't be gotten around. You cannot receive first dollar care and contribute to an HSA. So it was our recommendation that we do not look at adding that high deductible health plan at this time. And so that's why the renewal is our recommendation. Any questions?
None at this time, Jayla.
Great. On page 4, I show the medical contribution. I just want to highlight that we are budgeting at expected or at maximum, excuse me. The total is $1,625,004 It's a 54% increase. That's at the bottom of the page. On the right side column, it's a 54% increase to the county for healthcare claims. As you can see at the bottom, what we're showing you is estimated surplus should the county run below that worst case scenario. And so the goal is to hopefully we can see some utilization go down, particularly with your Grow Well partnership, and then be able to put some of those funds back into the health care reserve fund. But we are leaving everything the same for the employees.
I'm not seeing any questions yet, Jayla, so
Okay,
continue
great.
on.
Next slide on page 5 is the dental contribution. Again, this remains the same. The employee spend is 50% of the total premium, and the change to the county is $724. It's 0.8% based on last year's premiums.
Continue on.
Okay, great. Kelly.
Okay, so the next benefit is the voluntary vision, which is with VSP. Our 3-year rate guarantee, like Jayla had said, is expiring 12/31 of '22. This is a benefit paid by employees, but the recommendation that IMA received back after negotiation was the dual option. And if you'll see, okay, if you'll see in the gold box that's highlighted there, the 2 options. So the base option, should they choose that, they would see a slight decrease in their premium. However, they would have an increase in frame frequency, meaning they could purchase frames once every 2 years rather than once every year, which is what they currently have. The buy-up option that they could choose, they would keep the same 12-month frame frequency, have an increase in allowances on lenses and frames, but then see a slight increase to their monthly premium. So the recommendation here would be to allow the dual option and let the employees choose which plan best suits their needs.
These rates are also at a 48-month rate guarantee, so they would be set for the next 4 years.
Okay. All right, continue.
The next benefit is FSA. This one today will just be informational, no action would be needed. FSA is our flexible spending account. It's administered by Empower Family Health America out of Wichita. I believe we've been with them back since around 2015. This benefit allows employees to pre-tax their medical care and their dependent care. Empower recently updated their software, and when Jenny Newberry, finance director, and I were trying to balance the plan on our end, we were struggling with some reporting out of the new system that they migrated to. So that is why I had asked Jayla to go out and look for another company. During that time, though, Empower did provide the reporting that we need. I did meet with the county administrator and suggest that we give them an opportunity to continue to provide the needed reporting. So again, this is just informational, but should the reporting continue to be an issue, we may be back next year asking to switch plan administrators here.
Okay.
The next one is our employee assistance program. We've been with Health Advocate the last 3 years, and just like the vision insurance, it is set to expire 12/31 of '22. Jayla and the IMA team went out for quotes here. Jayla had received some positive feedback from USD 457 migrating over to the Optum plan January of '22. They provide not only the mental health piece for employees, but several other benefits around some legal support, some financial support and things. So the recommendation would be to move to Optum, even though there is a slight increase there. A couple of the benefits after I demoed this system that Health Advocate does not have is the referral to the local providers, and Optum was able to provide, it was around 15 local providers that they can refer to for in-person mental health care. And also, they have a management consultation program, which I could see benefit for our managers and supervisors as they are referring staff to EAP services, or for just ways to manage their team or manage certain behaviors within their team. Optum does provide quite a bit of marketing material for education and training. They do have some critical incident response services available. The 30-minute no-cost legal consultation assists with writing wills, medical advance directives, the financial support such as budgeting, identity theft and fraud resolution, some substance abuse, family and parenting to include child care searching, and then also they do have some relocation services. So some of these are new from what we've had prior, and so the recommendation would be to move to Optum for our EAP for the employees. And then if you'll advance one slide, please. And just to tag on to this, as a reminder, in addition to the local mental health referrals that Optum can provide, we did engage the mental health piece with GrowWell beginning January of 2023. I do believe that they plan to do a soft introduction of this mental health service and also provide plenty of education to the employees beginning December 1st. Any questions?
Just a minute, Dave. So this is the entire presentation that you want to make to us before we go to questions, and then
On benefits?
different motions? And
Yes, sir. Yes, sir.
Okay. So
Well, I have, if we could back up one slide, please. This, I'm sorry, the layout here is frankly a little bit either confusing or intimidating. Where are, I don't see like Compass involved here, and that's one of our partners, is it not? We
Right,
help fund
so
it.
the mental health referrals that Optum provides are to those Compass providers. So that is the list of providers that I received from Optum, that they would do the mental health in-person
That
referrals
answers
to.
my question. I was wondering, how does this fit in with
Yes, sir.
local providers? So,
Yes,
all right,
that is how. And the employees would receive those, just like it with Health Advocate, the 6 free consultations that they've had in the past, so.
Okay, thank you.
Dwayne, questions?
Not at this time.
Okay. Bob?
I'd like to hear after the recommendation, I'd like, let me see the whole picture, and then I'd like to ask questions.
Larry? I'll wait till then. Okay. So anything else that you want to present to us? And then I'm going to turn to Robert for his comments and so forth too.
Not on this, sir.
Okay. We have, with regard to this presentation, we have three motions that we're being asked to consider. And Robert, before we go to those motions that we're being asked to consider, comments from your perspective, and Jayla's mentioned you and Kelly had suggested maximum as far as the planning and so forth. Anything in that context?
Sure. Just to recap, we made some changes during the budgeting process, as you recall, about the employee benefits and so forth, and starting to shore that up a little bit. And so over the last 2, now 3 budget sessions, we've put in place a plan so that we can react better to these extreme swings that on occasion you see in health insurance. And that's what we saw here this year, mostly because of the low utilization during 20, because there weren't very many services being provided. And so there was an anticipation that once they start providing those, that we would start seeing an increase in the activities of the employees. And secondly is that one of the things that about this time last year that we presented to you was to enter into a relationship with GrowWell, which has significantly allowed our employees now to utilize really a really good care facility for their everyday use general practitioner type needs. And I think combined with that and what we've seen in some of the increased costs here is that we're anticipating eventually that will help stabilize and reduce these larger swings that you see.
Okay. So with those comments that we've heard in the presentation from Kelly and Jayla, we're being asked today to consider 3 different motions. And you can see those on the screen right now. And the first is with regard to the medical dental. And the option 1, I don't know if we can go back to that option 1 on the screen.
And if I may interject, it would actually be renewal. We were working on a couple different drafts of this. So the recommended renewal action is the renewal, as is, no changes to the plan design.
What's the dollar?
Right, but that's what I'm asking for us to go back to that screen that has that information on it. Right there.
The total dollar amount is going to be $5,661,137. That is an increase of $1,660,622.
There you go. So with regard to that, any additional questions or comments from the board? And then I would entertain a motion if you want to approve this. Go ahead, Larry.
I'm sure I asked you this when you first presented this, Jayla, was you cover lots of public institutions. Are these increases out of the norm, in the norm? Give me an average.
Yeah, so, and I would say this year across public and private sector, we are seeing some larger increases. Maybe a delay of utilization based off of COVID. People put some things off, found some things later. Now there's some more expensive treatment to take care of those. Among what I am seeing different is among the public sector, and even the private sector more so, that there is a lot more appetite to share the increases with employees when we see renewals such as this. So, I want to say I commend the county and the board for considering leaving the employee contributions the same, because that is outside of the norm of what we are seeing in the market.
Okay, now the next question is, what do you anticipate? Hopefully this is a 1-year event.
Well, so Blue Cross underwrites based on 36 months of data. And so last year was our heaviest weighted period. It was almost 50% of your total renewal. Next year, the 2021 plan year is going to have some impact. It's going to be about 25% of that. Through August, the plan is running at 118% of expected. So we're having another high utilization year. And this year, 2022, is going to be roughly about 50% of the renewal. If utilization does not come down in the next 4 months, then yes, it's very likely we'll see another increase like this next year. Maybe not as dramatic, but yes, it will be an increase.
The bottom line is it's based on the utilization for the last couple of years. Mm-hmm. Any other questions, Larry?
No.
Bob?
I'd like to have you just repeat what you just said. The 2021 was 118% utilization?
No, 2022, the plan, or I'm so sorry, 2021, the plan ran at 120%. It hit maximum liability. They based the 2022 renewal using almost 50% of last year weighting in order to get this year's renewal. They've basically said, we will continue to see high utilization in 2022. And their underwriting has been spot on in that. In that through August, we're running at 118%. So almost to maximum liability.
Okay, I heard 50% and then I heard over the maximum, and I was trying to reconcile those two things.
Yep.
The contribution at the employees in 2022 are at a situation, and the 2023, their contribution will be up 20%. Is that the?
Their contributions are remaining the same.
Flat. You're not going to raise them at all. So whatever we approve, it will all be coming out of the county budget. Okay.
That's the recommendation. That's,
And then, not necessarily you, but Kelly or Robert, the other piece of the puzzle is what are we paying Grow Well? So that's going to need to be an answer, at least for me. So as long as we have that somewhere.
We pay Grow Well approximately $360,000, if I remember correctly.
We added that 50 for mental health, and that's included in that.
Yeah, just somewhere around that 360,000.
And in your opinion, at this point in time, that money that we're spending should have been saving us something on this side, but she's telling us we're still spending 18 to 20% more than we should be spending.
Well, keep in mind that the experiences that are pushing it are more of a major nature, and that's outside the purview of Grow Well.
Okay. And then we have the stop loss in there somewhere that's picking up the rest, and we're even blowing over the top of that.
Correct.
Thank you.
Growell, the last report I did receive from Growell, they had delivered around 1,800 visits in the last year. The end of October, I will have 1 full year's worth of data from Growell to present to you, as November 1 was our date that we went on with them last year.
Okay, thank you.
You're welcome.
Dwayne?
I'm still absorbing, just continue on.
Dave?
Not right now. This is astounding, isn't it? But it's part of the package of inflation. So we can tell our taxpayers this is where a big share of your tax money goes. We have to, by law, take care of our employees, and by ethics, we want to take care of them, and yet it's a high-priced proposition. So
That is
I think
true.
that's else to add.
So one other clarification before I entertain a motion, then if we stay with the recommendation of keeping employee contributions flat for 23, we have included that increase in the budget numbers that we approved recently for what the county's contribution would be. Am I correct on that?
That's correct.
Okay. So that was in the budget that we approved, and no surprises from that standpoint. Yeah. So at this point, just entertaining the Blue Cross Blue Shield medical and dental renewal, what is the board's desire?
Can we ask more questions?
Well, we can either do that or have a motion and then have more discussion. Either way. Go ahead if you have more questions.
I just, it looks to me like the big elephant in the room is, how do you cut down on utilization so much?
Mr. Chairman?
Just a minute. Jayla may be responding to that.
I'm trying to think of how to respond. I mean, a lot of what's driving this increased utilization is high costing prescription medications. And oftentimes those specialty medications are tried, and that's what works. There are rebate coupons that are associated with that the county does receive back from Blue Cross Blue Shield. It's 80% of RX rebates, but this is a problem we're seeing across the board, and why Blue Cross in your situation is continuing to underwrite these ongoing claims, because prescription costs are prescription costs that they know are going to happen on a monthly basis. And so that's why they are continuing to underwrite the increased cost of claims.
Jay, the one clarification question related to what Larry asked. So to put this in context, you're talking about prescriptions with regard to diabetes, heart disease, those kind of things, or?
I'm talking like the medications you see on TV that are advertised. Those are very high costing prescriptions, and that is what a lot of members are taking.
Okay, thank you. Dave?
Well, my point I wanted to make was partly covered here, but the uncontrollable of all of this formula that we're dealing with is the open heart surgery or the cancer and those things, because Well obviously doesn't handle that, nor do we have a way to contain the cost. It's costly and it keeps going up. And so I don't know whether the insurance carrier still sends a kind of a generic to our safety folks, to our workforce, to Paul Rusley and crew, so they can kind of see where the trends are. The clinic to have more healthy living helps, but it doesn't eliminate. And so I think that's probably, if we could dive in, because of some of the records concealment by law, the HIPAA or whatever, we can't see what a patient's costs were, but somebody can in our organization, IMA or whatever, and those are the ones that we cannot control. So.
We'll go here first. Dwayne?
Well, Jayla, from what you just told me, it's not necessarily the surgeries Dave just mentioned, the heart surgeries. It goes back to the high cost of prescription drugs more than.
Yep.
Are the operations and so forth fairly consistent year to year?
Those are, I mean, those come up here or there. Some of the conditions that the commissioner was just speaking to are, do show up. There are surgeries, there are cancers, but we're seeing a lot of prescriptions on your high cost claims reports.
Okay.
Bob?
We always tend to get into this business versus government model. When a business attacks something like this, the decisions that she's sharing with us are decisions made at the employee level. And we have the situation where we really can't control that because that's a decision they're making for their health. But when we have employees who know and understand the problem that's being created, the overall problem, that they do have a choice. And if they have some skin in the game, for want of a better term, either through copay or some other element, then there is a little more of a decision to be made on their part. Right now, if we go in the same situation and we increase our out-of-pocket costs over 40%, coupled with what we're going to do here in a minute in pay scale, and we don't do anything on this other side on the employee contribution, there is no motivation on their part. Good people that they are, great employees, and we've got to have them. But it ought to be something that we're in together. And I think asking them to share in this quest to control the budget is something that we ought to consider. And I'm assuming that's going to be another motion down the road. But in answering that, what can we do to control, they have more say, or almost as much say as Blue Cross Blue Shield, because that's where our utilization comes from, and that's the selection, and hopefully through their physician, they can find an alternative to these particular drugs.
Well, Jayla, you gave us a figure, because I think I asked you this when you were giving this presentation about utilization of pharmacy versus other areas, and it was extremely high. And I don't know if you still, can you pull that up handily or?
Yeah, I have it here. I have the claims report in front of me. So the medical spend for 2022 so far this year is 52% of claims. Prescriptions are 48%. And typically in our book of business with Blue Cross, we're seeing closer to 30% spend on prescriptions.
Yeah, that was what I was really
yeah.
getting at. That's,
Some big impact.
yeah, it's a big impact. When doctors recommend generic or off-label prescriptions, what's the requirement to follow those, or what? That's just a choice.
They're basing that on their expertise, and I don't really have a window into knowing why or how they make those decisions.
I'd like to go back to Robert and Kelly, and then Jayla, if you want to chime in, but I think this is more to staff at this point. To Bob's question, I don't remember when it was that we did increase the employee contribution. And
Last year.
it seems like it increased, I don't know if we did it all at the same time, but we increased copay and so forth too. But would you put that in perspective for us as it relates to why you are not recommending an increase this year in the employee contribution?
Last year, if you recall, we went ahead and made some adjustments to the copay and as well as the employee contribution. We did not, because of 2020, which is primarily what last year's numbers were based off of, we did not see that high experience, if you will. So in essence, then we made those adjustments, if you recall, and I don't recall the dollar amount per grouping, single, family, and so forth.
I've got it pulled up here, Robert. Last year, the employee rates increased by $453,707. So that's all combined, moving from one plan to two plans. And that was based on our migration estimations.
And then, so as we looked at this year, we kind of took into consideration some of the things that the Board of County Commission had been saying as we began the budgeting process back in March, April. And that message was to commit to the employees and so forth and try and increase their wage and while still maintaining this current level of benefits that we enjoy here. So it seems like to pass on additional costs to the employee kind of contradicted a little bit of what you were trying to achieve in focusing on trying to help the employees out. So in addition to picking up the county, picking up the tab on the increase, then we looked at making some adjustments to the wage so they actually see a real increase in what they're able to take home. In essence, passing this on then would probably have a tendency to negate a lot of the things that we were trying to achieve with that steady wage increase. So I think Bob's comments are appropriate, is that oftentimes that and the educational aspect of trying to promote a more healthier lifestyle can make a major impact. But once again, we've all along the county's tried to maintain this health care plan, and the value that it provides to the employees.
And I want to just take that one step further. Again, just to put this all in context, because I'm not in disagreement with what Bob says. The employees have to have some, in Bob's terminology, some skin in the game, and they do have some. You know, is it the appropriate amount? That's up for debate. I understand that. But help me recall when we asked employees a few years ago to have some more skin in the game, if you will, and we decreased some benefits and we increased their contributions. Hadn't that been within the last 5 years or 4 years or?
It was
Jayla, I
for,
see you're ready to speak to that.
yep. It was for the 2022 renewal. So the changes we made last year where we increased co-insurance from $200 to $1,000, and we added a second deductible option. Actually, we raised deductibles and added a second. So prior to 2022, you had a $300 deductible with $200 co-insurance. So last year we now have a $500 deductible, and then $1,000 deductible, with that increased co-insurance. And we ended up increasing, as an example, the family premium on the $500 deductible went up $301. It was the increase that employees took on last year when we made those changes. So there was significant cost to the employees to take on those increased contributions last year, some increased out-of-pocket expenditures as well. And then when the budget shook out, the county actually saved a little bit of money last year with that increase to employee contributions.
Thank you for that context. Yes, Kelly.
Prior to that, we had not had a significant increase since I've been here. So,
And you don't underwrite any of the deductible?
That's
As
in the
in,
employee
do
pocket.
we-
And it stays out of the employee pocket? They don't have an opportunity to reclaim it? Okay.
correct.
Well, they would through a flexible spending account. I mean, it's still their money. It's not coming from the county, but they would have a way to get a little bit of benefit if it's coming from their
Right, pre-tax,
flexible spending
correct.
account, to help them with that.
And so if we take your percentages of 52 and 48 that are medical versus pharmacy, and the typical norm is 33, so we have 15%, we're kind of out of balance. So we're $800,000 to $900,000 of our premium expense is on the drug side. I just think we have to pay attention to that, and if nothing else, maybe at the employees meeting that happens next Monday, this needs to become a real deal, because if it continues like this, and we sit here again when you sit here again next year, and you have another 40% increase because no one's paid attention to this kind of a deal, it'll be real serious.
Prescriptions is something Blue Cross Blue Shield is looking at continually. They are putting new programs in place, and there are new solutions coming to the market that we will be sure to review for next year, related specifically to prescriptions.
Yeah, thank you. Dave, I think you had to. Right.
Kind of put things in context over history. For years, we grumbled here as a commission about folks going to the emergency room at the hospital for a minor whatever. And so we came up with a brilliant concept that was going to save money, and it was called an employee clinic. And that started off with great hopes and expectations, and a little bit we realized, I think the last year we had our clinic, it had about 30 of our 300 plus potential clients that used it. So we migrated from that to Grow Well, but Grow Well, Bob's question about the deductible, if they go to Grow Well, they don't have a deductible.
Correct.
If they go to the emergency room, they have a deductible.
They do. It's a copay. They have a $200 copay, and then the ER visit itself is subject to deductible and coinsurance.
The expense on prescriptions, I find interesting. I happen to be of an age where I take a handful of pills, and one of them is called Jardiance, and that's an A1C aid. That pill cost me $8 a day, $8 a pill. And so I asked my medical doctor if there's a cheaper variant. And he said, well, yeah, but they don't work nearly as well, and he would not recommend them. And so some of these were just forced to pay the price. To me, I've had other prescriptions that were more expensive, but boy, when your doctor tells you this is what you should have, it's hard to go to the generic if he won't recommend it. So anyway,
Well,
our reinventing the wheel, and I agree with what's Bob's concern, but we keep trying something new all the time to get the employees. Oh, I'm sorry, did I? Good for you, thanks. My mic was shut off. My point is that, yeah, we want the employees to be conscious of the cost, but we keep trying to invent something that's a magic pill, and I don't think we're going to have much luck finding it. So anyway, enough said.
I appreciate Jayla and IMA and Kelly and Robert keeping an eye out for these new things, new tools that Blue Cross Blue Shield plans to market and so forth, because that's the only way we're going to be able to address some of this stuff. So with that, if there's any more discussion, we can have that once a motion is made, and we can move to reject or we can move to accept the recommendation.
You have a motion and a second to accept.
No, I do not.
I'll offer the motion to accept if you don't have one.
All right. There is a motion on the floor to accept the recommendation as presented to us with the increases and keeping the employee contribution level for 2023. Is there a second to that motion?
I'll second.
Seconded by Dwayne. Now, any further discussion or questions? If not, all in favor of the motion, please say aye.
Aye.
All opposed, nay.
Nay.
One negative vote. The motion passes. Next motion that we're asked to consider is on the vision plan. And just give us a quick recap, Kelly or Jayla, whoever.
we would like the dual option to be considered and give the employee a choice to either choose to have a decrease in premium, but an increase in frame frequency, or to keep the same frame frequency where they can buy frames each year rather than every 2 years. But they would see a slight increase in their premium. This is all employee paid. We feel it's important to give them that choice.
Okay, and it is employee paid, as she stated. So the motion, if you want to approve this, would be to approve the dual option plan.
I move that we adopt the dual option plan for vision as is employee paid.
Okay, and is there a second to that motion?
I'll second.
Seconded by Larry. Any further discussion or questions? If not, all in favor of the motion, please say aye.
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 All opposed, nay. Motion passes. And then we've been asked to change the employee assistance program to opt-in. Any summary comments, Kelly?
I feel that with the few extra things they can provide, and the big thing being the referral to the local providers, and a majority of them were at Compass. I don't know that they all were. But I think that's going to be a huge benefit, because that's where I see the most negative feedback with where we're currently at. Some want that in-person referral that they were not getting, so.
So what is the board's desire with regard to moving the employee assistance program to opt-in?
So moved.
Moved by Larry. Is there a second to that motion?
I'll second.
Seconded by Dave. Any further questions or comments?
And how is this funded?
By the county.
And so we're funding this program instead of a different program that we were
Correct.
doing before.
Yes, sir. Yes, sir.
And,
And the cost difference was about $2,000 annually.
okay, thank you very much.
Yes, sir.
Excuse me. Any other questions or comments? If not, all in favor of the motion, please say aye.
Aye.
All opposed, nay. Motion passes. I think that's the only things we were asked to act upon today. There were some other informational things that you presented, and am I correct on that?
Yes.
Okay,
Thank you.
all right. And Jayla, you're done with us this morning, right?
I am. It was a pleasure to be with you all this morning. And again, I just want to say thank you for your actions on this. It is commendable, given the economic situation, to keep those employee premiums steady. And I really appreciate your partnership on that.
And thank you for the work you do for us, for here at the county, and keep your eyes out for those plan enhancements.
Will do.
Thank you.
Thank you.
Thank you.
Have a blessed day.
You too.
Next, Kelly, I think you have a pay scale adjustment
Correct.
presentation.
So for a little background, and you have two scales in front of you, if you'll look at the bottom, what is highlighted in yellow, that'll differentiate the prior one from the new one. Any of the changes I'm asking for are in blue on the sheet. So in July, the commission approved this updated pay scale that was presented at the time. Some increases to bottom pay, adding a few additional grades, and then the additional 4 pay scales for the disciplines that may require more frequent market adjustments. And that was for the sheriff, the health, EMS, and public works. So after completion of the job description updates with AGH, and then during the grading process, some additional market information was received, and the initial naming of the grades and the original scales were confusing. So what I'm asking today is a slight adjustment to 2 items. Again, the changes are indicated in the blue highlighted areas. So number 1 is just renaming of the grades within those other scales to coincide with the administration pay scale, but identify the scale with a letter behind the grade. So for example, H for health, S for sheriff, and C for construction, which is public works. As we do use the same compensable factors for all of the grading, this clearly identifies where the grading fell. This one here is just more of a cosmetic fix to what we had prior. My second ask would be to combine the EMS and health grades, and a slight increase to the bottom view, as you can see on the sheet. That's different from as what was previously presented in July. So these additional lower level grades are actually going to now be needed at the health department, as we're still struggling to recruit at the RN and LPN level. We have added the levels of CNA, CMA, and those are more in line with the pay grades of an EMT, AEMT. And so that is why I'm asking to combine the health and EMS into one health scale. So the new scale I'm asking would be the one that would be adopted at the bottom highlighted October 3rd. And again, the changes are there for you to review.
With that, I'm going to look at Larry first, just see if there's questions or comments.
Heavy right now, but
Bob?
How do people move from grade minimum forward? How often and how do they?
So when we hire, current pay policy is we can hire within 25% of the bottom if they come with some relevant experience for that position, but that's all looked on at a case-by-case basis. And with these, we had pretty significant increases to the bottom. So I don't think that we'll see a lot of movement, maybe up to that 25% level, but that is still in policy. As far as moving through the grade, that would come with the annual increases. Moving to a different grade would be something with the position that has significantly changed, that is compensable, or, a promotion or whatnot into a different job that has a different grade.
Maybe some certifications or training or something might be, would that be part of it or not?
Not at this time. We don't have anything built in for a percentage for, certifications or whatnot. That's something that, we've definitely talked about in the past and can look at, but at this time, we have nothing set on that.
Go ahead, Bob.
The 10% maximum still there?
For promotions, yes, at this time. Mhm.
So So even if they jump and shift or whatever else, it's
They would at least go to the bottom of their new grade, or if it's not, whichever's higher. So then if not, they would move that 10, they could move up to that 10% for a promotion.
okay.
If the bottom of the grade was higher than 10, they would go to the bottom of the grade.
Dwayne?
They'll come back to me.
Okay, Dave?
This is plan that we've already approved, correct?
The prior scale, yes, I'm changing
And-
the name of grade.
And so you're making some little adjustments. The big adjustment's gonna be in 2 fiscal years down the road where we don't have ARPA funding and whatnot to help. But we've already agreed to this in principle and voted to approve the plan, so
Correct. Yep.
I'm in support of moving forward with it.
And Dwayne may have a question, but, so today, we really don't need to take any additional action, do we? Or do we?
I do need you to approve the new scale with just the few changes that are
Bring
made
those
there.
two together, you mean? Okay.
Yep.
There made some,
She's made a few minor adjustments, and as far as classification, for clarity, that goes back to the compensable factors to be consistent with was adopted back in 18 or 19, 2019.
So it would be, if the board's inclined, it would be a motion to adopt the plan that's presented to us today.
Correct, with the authorization for the chairman to sign off on it. And keep in mind this is what staff has been working off of as we've placed the employees back on the scale.
Right. Dwayne?
Just to get it in my mind, it doesn't look like the actual pay has been changed that much. For the most part, it's just a reconstruction of the grade.
So the naming of the grades, I would like to be consistent with ours, with a letter behind them identifying which scale they fall into.
Okay.
Health, sheriff, or construction. The few minor changes that did happen were at the bottom of the health grade, from that 1340 up to 14, 1433 to 15, 1535 to 16, and 1645 to 17. Those are the only adjustments there.
Okay.
Also, with this separation like that, it gives you an opportunity as certain professions increase higher than others, you can make those adjustments without doing an entire broad scale
Right.
screen.
Yeah, understood. Yeah.
And what happens when somebody hits the maximum and doesn't have the ability, the desire, or whatever else to move? Where do they go? Do they just get a cost of living after that? Or?
Yeah, so the past practice of the county and what we're currently practicing still is that they receive a lump sum payout of the percent set by the board. So rather than see it in their hourly wage increase, when they get to that top and max out, they stay at that max point until, and if the top ever moves. But we do still pay them a lump sum of, and this year it'll be the 2.5%.
the longevity pay is still
Absolutely. Yes.
included in it.
Yes, sir. Every 5 years, they'll still receive the 5% longevity pay that every 5 years they're with the county.
That is a lump sum, correct?
Yes, sir. Mm-hmm.
So what is the board's desire with regard to this modified pay scale?
Mr. Chairman, I'd offer a motion to approve the application as it's laid out. We've already approved the plan, but to approve the request to implement this pay scale.
All right, there is a motion. Is there a second? And Robert pointed out, the motion would also include the chairman's signature. Is there a second to the
I'll
motion?
second.
Seconded by Dwayne. Any further discussion?
Just
Yes,
as a
Bob.
point,
Go ahead.
when we get something like this full of numbers, could it come out in our packet so that we'd have enough time to?
I tried. I was struggling. We're trying to get the in-service done as well. So between the job description, the wage adjustments, I did try to get it in the agenda packet. Dory finally had to publish. So I worked over the weekend to get it done for you. So you're welcome.
And to follow up with that, your discussion would help too, for me to follow it instead of just the numbers, what you sort of give some examples like you just gave. That would be helpful for
Okay.
me.
All in favor of the motion, please say aye.
Aye.
All opposed, nay. Motion passes. Okay, you want us to approve holidays.
I do, so,
Oh, we're changing the dates on the holidays?
sure.
Do we have Larry's birthday
Fourth of
on
July
there?
is no longer, huh?
We don't have,
Third.
I wish.
I thought your birthday was a legal holiday, Larry. I didn't see that on here.
So the
Sorry,
board's,
Kelly.
that's all right. I will tell you the calendar that I did send out, I will admit I had, so the calendar that was sent out, the days that are highlighted in pink are the holidays, the green are the paydays. I send this out to staff. I did have one error on the one that was sent in the packet. I did have January 1st marked, that is a Sunday, it should have been January 2nd. The wording was correct on the agenda item, I just had that small cosmetic thing. The calendar on the screen is correct. So we're just asking you to approve the holidays. I have the 10 holidays listed there. Per county policy, if a holiday falls on a weekend, it should be observed the preceding Friday or the following Monday. My recommendation would be to approve the holidays as listed below, and that we observe them on the days listed. There are 2 holidays that fall on the weekend. That would be New Year's Day, and I'm asking to observe Monday, January 2nd, and Christmas Eve. I am asking for that to be observed Friday, December 22nd.
What is the board's desire with regard to the holiday schedule for 2023?
Mr. Chairman, I move that we follow the recommendation.
There is a motion, is there a second?
Second.
Seconded by Bob. Any questions or discussion? All in favor of the motion, please say aye.
Aye.
All opposed, nay. Motion passes. Thank you, Kelly. Jenny?
Here, I thought I was gonna get out buying Christmas.
I know. Next year, maybe, or next time, maybe, yeah.
Good morning.
Morning.
Good morning, Jenny.
I am presenting Resolution 43-2022, authorizing the creation of a fund for the purpose of tracking the revenues and expenditures related to the opioid settlement disbursement funds. The county entered into a class action suit with Derek Schmidt's office previously, and this, as the Kansas Fights Addiction Act has directed that the Attorney General enter into a memorandum of understanding with the League of Kansas Municipalities and the Kansas Association of Counties to establish the requirements and procedures for distributing monies out of the municipalities Fight Action Fund. County previously agreed to abide by those terms of that MOU, which includes setting up this separate fund to track those. The county has already received $6,717.09 to date. These disbursements will be periodically paid out to counties over at least the next 18 years as those settlements are paid out to the Attorney General's office. Recommendation is to authorize the creation of this separate fund.
You've heard Jenny's presentation. It's really a procedural thing with regard to handling the opioid settlement funds, and it would be Resolution 43-2022, if I'm not mistaken, that we would be adopting to set up that fund.
Mr. Chairman, I move we approve Resolution 43-2022.
Is there a second to Dwayne's motion?
Second.
Seconded by Larry. Any questions or, yes, Dave, go ahead.
A little clarification. By adopting this resolution, we're specifying where these funds go. And then the resolution says they can only be expended for certain things.
Correct.
But it doesn't tell us what the things are they can be expended on.
There was a list of things that were provided in that memorandum of understanding, and they were specific to, they were things that could be used towards programs that would prevent.
Which is making my point. Should that be attached to this resolution, so, okay, you got the money, you got a place for it to go, you can only spend it on these things. So,
Yes, it can be attached to it, but those are really federal guidelines, if you will.
policy and they can change, that I understand.
Yeah,
This
We're just
kind of
complaining.
standing by itself, doesn't tell you what you can spend it on. So, okay,
it wouldn't be a part of the resolution, but it certainly could be attached to the resolution.
Yeah, we're required by being a part of the suit to spend only in accordance with that memorandum. But that also specified that we have to track those separately from other funds so that we can report back to the Attorney General's office.
And we've referenced the MOU in paragraph 2 of the resolution.
Correct.
yeah. So if that were set out a little more, anyway, it kind of left a question. I'll be happy with whatever. It's not going to be that big of a deal, so.
Yeah, it'll be a part of it because it's referenced in the resolution that we'd be adopting, so. Any further questions or discussion? If not, all in favor of adopting Resolution 43-2022, please say aye.
Aye.
All opposed, nay. Motion passes.
Thank you.
Jenny, thank you very much for the numbers.
Welcome.
And for the same reason I talked to Kelly, it'd be really nice if we had these in our packet so that we could look at them and, because by the time we get here and do what we do, there's not really a chance to run through them.
Next time I will attach the memorandum also, so you have that information for you to.
Thank you very much.
You're welcome.
Thank you. Appreciate it, Jenny. Okay, so now the next part of our agenda, I want to try to bring to closure, if we can, the adoption of the board's priorities. We've already, and we haven't done it officially as a motion, but we have stated that our mission statement, our vision statement, values and goals we had one change in the goals, and that was to say available resources rather than available revenues. But then the second and third pages of our priorities, we need to try to come to some conclusion on this, in my opinion, to move forward and also to give some clarity to the staff as far as what it is that we think need to be accomplished. As we do this, though, you'll notice that there was a little bit of change in format on pages 2 and 3 from a standpoint that I was hearing some confusion through our discussion on what it meant to be ongoing and immediate. And so as I visited with Robert a little bit about this, I don't remember, it might have been Robert that came up with this idea, but somehow in the discussion, we came up with the idea of not mixing immediate and ongoing, and clarify the ongoing, or I also use the word continuous, but clarify those as initiatives, where the others, immediate, intermediate, and long-term, are the projects that we'd like to see addressed during those timeframes. So you'll see quite a list of bullet points in the continuous and ongoing, and I would just simply call your attention to the measurement tools that we're suggesting at the bottom to be done on a quarterly basis. And I know Bob asked the question one time, what does quarterly mean? Well, in county budgeting, we use a calendar year, and so to me, quarterly means on a calendar quarter. Now, if we want to clarify that, we can, but so the first quarterly report, if we adopt this, would be in January based on that reporting mechanism. Secondly, based on suggestion that was provided the last time we had discussion, you'll note on the immediate, intermediate, and long-term that I took your suggestion, whoever made this suggestion, of using budget years as trying to define what immediate, intermediate, and long-term meant. And so that's certainly open for discussion, but that's what I heard being discussed the last time we were together, were those timeframes, immediate being the next 1 to 2 budget years, and so forth. So with that, and I apologize too, back to Bob's question about not having things ahead of time. I apologize for not having this, but I was away from a computer all last week, and we were doing review and revisions, and I didn't get that completed until Saturday after I returned home. So I beg for your understanding of why the lateness of getting this information to you. The primary thing, though, is most everything that was in the previous documents is on these 2 pages. Most everything that you had asked about, talked about, we included some specific projects like the Randall Estates, the Southwind development that's taking place, and so forth. But we just recategorized a lot of the things that were in immediate and other categories under initiatives and made there's really nothing new as far as the items. They're just how they're rearranged and how they're categorized. So with all of that being said, as a preface, I'm going to turn to Dave first and see what comments you might have. And if we can bring this conclusion, that'd be great. Certainly, I'm not forcing you to conclude it if you have open discussion yet. So, Dave, let's start
Chairman, I
with
see
you.
this as I'm going to say, living document. And so I'd be inclined to adopt it today, but know that it lives, it can change as circumstances change. So that's, I've not had a chance to deeply digest it, but I think it covers what we as a group had a consensus ought to be in 2 pages, so.
And you're absolutely correct. If the board decides to change something, if a project gets completed, we can amend this document at any time. There's no time frames on it. But this is to try to give staff some guidance and ask for feedback from staff. So
The only other thing I would add is it gives staff an opportunity to kind of report to us also the progression of various things as they're going along, so.
yeah. Wayne?
Actually, I'm still reviewing the 2 pages, so.
Okay. And that's okay. And that's all right. Bob?
Hearing the last thing Commissioner Jones just spoke about, I think the last thing staff needs is one more major task to do. I think some of these goals, as you look at the continuing deals and the intermediate type deals, needs to fall onto this board. And there will be different things that will need to be followed, but I can't believe we can't just keep pushing it down and saying, Robert, you guys go get this handled and let us know how it came out, because he's got a plate that's pretty full. And I think there are some relationships within the city, the county, the school districts, whatever they all might be, that impact all of those continuing things. And the relationships you have with Workforce One and CVB and economic development and aging and the library, that all impact the things that these goals are speaking toward, that we can carry a hell of a lot of that load. And then the other thing, I think, as we watch Lon and Robert do their thing this year, they got a lot on their plate. I think a vice chairman, and whoever you appoint next year, needs to own this document. And that ought to be the person or some other board member that keeps this document alive, because all of the work that sits in that chair and all of the administrative work that goes on all the time, it's a full-time job. But if somebody doesn't own this document and drag it out of the drawer more than once a quarter, because once a quarter, it needs to stand up and say, hey, sorry, we didn't get anything done, or hey, we got these 3 things behind us. That's the biggest problem I've had as we sat here this last year, is that we got it out of the drawer. We talked about it in January, and we're in October, and we're finally kind of reformatting it, and we really haven't focused on what this document is. And as I walk away, I'd really like to make sure that sooner or later we start paying attention to it. That's
Well,
I'm sorry.
let me just add, and I appreciate what you're saying with regard to the chair's role and the administrator's role. And no question, there's a lot on our plate. However, there are things within this document, in the ongoing and continuous, particularly that are board responsibilities. And I'll just simply point out one, and that is the development of our legislative agendas. That's on us. That's on us as a board to coordinate that, and not on the administrator. So it really is a document that incorporates some administrative things and some board things. I appreciate what you're saying, who's accountable, and who should take the lead. The projects is what I look at as more staff or, staff bringing information back to us and so forth. But I do appreciate what you're saying about who's responsible for pulling this out of the drawer. And yes, we do need to be more diligent and have it in front of us on a regular basis. I absolutely agree with you on that. Larry?
I was wondering if, to move from like next 3 budget years to immediate budget years, how do you move? Is that just at the whim of one of us?
I think it's the consensus of the board. I don't think one of us by himself.
But I mean, if one of us brings it up.
Oh, yeah, right. If somebody says, hey, that should be in, and I think that brings it to the, under board governance, each meeting, then that brings it to the floor for discussion on whether it should be moved or not. Yes, that's the way I would envision this document working. And and now I'll simply add too, we've talked about, grant funding and other funding sources might dictate some of that on whether it's immediate or intermediate and so forth. And if we thought we had something going and it was immediate, but then we found out the funding source wasn't there, we might be moving it from immediate to intermediate. We might not be moving it up, we might be moving it down in time frame because of circumstances. So, yes, that's part of the living document thing that Dave pointed out, and also ties to what Bob says, it needs to be on our desk every time we meet. Just like the mandates are on my desk from the state every time we meet. Anything else?
Not right now.
Well, kind of back to Dave's comment, knowing that it's not something that's set in stone that can't be changed and so forth, but to give us guidance and to give our staff guidance on projects and so forth, is the board inclined to go ahead and adopt this document as of today, and then we have it in front of us each and every meeting?
Are you looking for a motion?
If that's the desire.
Then I would offer it that we approve this for in the drawer, whatever we.
There is a motion to approve this document going forward, and with the understanding it is not something that cannot be modified. It is something that is living in front of us each and every meeting. And is there a second to that motion?
I'll second.
Seconded by Bob. Further discussion or comments?
Quick point, a couple changes that where I see this as living, and I'm going to use an example and then a potential. An example was, I remember a conversation we had about road and bridge projects, what ought to come next. And probably the least important road in our thinking was Mansfield Road. And about the next meeting, here comes Lana to tell us about a little transportation company that's going to move milk, and they're going to be on Mansfield Road, which suddenly changed that. And that's what I'm talking about. We need to be able to grab that that's sort of a project that needs immediate or more immediate attention. On the other hand, there's a bill and a mood in the legislature to do away with sales tax in certain areas. I have no idea what doing away with sales tax on groceries might do to the income of sales tax to Finney County, but it may impact it.
Won't. Today it won't, because it's the only.
They're not through, yeah, my point is they're not through discussion. So that could slow down something that is kind of sales tax dependent, so. That's,
Yep. It would, if they changed their temperament on that, it would definitely change our thinking, yeah.
So you're saying quarterly, we will pull this out of the drawer and go, okay, here's the list. And we'll go down each one of these and say,
I'm planning on having this on my desk at every meeting.
here's
But
an
there'll
update
be,
on this project.
there'll be updates and progress on
Okay.
at least a quarterly basis. Yeah.
can we put that on the agenda, Lon, quarterly, that we review it?
Sure. Yep, sure can be. So Dory and Robert, help us remember to put those quarterly reports on. So, and again, please, one last comment. I don't want us to be so locked into the quarterly that if something comes up next month, that we say, oh, we can't discuss that because it's not on the quarterly agenda. Well, yes, we can. We can discuss it at any
I
particular
don't think
meeting.
that's ever been a problem with this.
Well, not as long as I've been around here, but, but anyhow. All right, so, let's see, we haven't voted. We have the motion, and the second. And, so, all in favor of the motion of adopting this, going forward, please say aye.
Aye.
All opposed, nay. Motion passes. All right. And the only reason I'm hurrying along here today is because my commissioner to the left says I'm on a time crunch. Oh.
Maybe.
Next, we'll get into the reports, and let's start with the county administrator.
Well, as you can tell, we've spent an awful lot of time on your, on the wage study, getting that implemented, and as you are aware, that goes into effect now, so the first pay period, the first paycheck in October will reflect those changes. So I think we're looking forward to moving on from that and getting on to other stuff. Been meeting with Kurt on sewer district improvements, starting to get those underway. I know that he is working on the sewer district 3 right now as far as the scoping of it, cleaning of it, and making any repairs to lines as needed, and going through the process of developing the standards for those improvement pump stations for those items. So that is ongoing, and I think that's actually one of your immediate projects within here by way of reference. A couple of weeks ago, we went through a review from Homeland Security. We came out, did kind of a safety and health check of their county buildings and so forth, and developed a grocery list of things to improve and to reactivate that safety committee that had been dormant for a few years. So we're moving forward on making we'll be moving forward making some improvements to some of the facilities. Simple stuff, exit markers, things of that nature. I mean, so we're, that ties back into energizing that safety committee and security committee. So that was a big part. That really helped us get refocused on things that we needed to improve. As you're aware, Kelly mentioned that we do have a in-service next Monday, all day, have speakers scheduled and so forth. Last year when we did this, the chairman, Dave, was there to give some opening remarks. Request the same this year. I think, Lon, I think you're not available.
I'm out of town.
Would somebody else be willing to
available?
take that task on Monday morning? Yeah.
On the 10th. That's the in-service day for the staff.
I mean, keep it,
Dave's good at doing that.
What are we asking Dave to do? I was tuned in over here.
We pull out your,
being passed in a hurry. Sounds like
pull out your notes from the last time you did welcome to the in-service, and you're going to be asked to do that again Monday on the 10th.
try and keep it to
I
less
think
than
I
an
have a
hour.
conflict.
You- Okay.
Dave has agreed.
On the 10th at 8 o'clock.
Correct, and those of you that can make it, I would encourage any and all commissioners to be there. It kicks off at 8 o'clock. And it concludes at 4:30? 4:30. So I know last year, I think we had a few commissioners kind of float in and out just to see what was going on and so forth. So we would encourage you to do the same. So
Yep.
there we go. That's it.
All right. Linda.
Last week was primarily spent on moving forward on the RHID for Randall Estates. Just a lot of language and documents that are being passed around and approved. So that should be on your agenda for the next meeting, the resolution and the development plan and the development agreement, all of those items. And then tax sale, I think I have all of the parcels now from the title company, so I should be able to make progress on that this week. Wish me luck. There's a lot to work on for that. I think that's mostly what's on my plate at this moment.
Okay. Well, appreciate your work on checking out that neighborhood development agreement as we asked you to do for Holcomb, and appreciate your work on that as well as the other things you're working on. So thank you for that. Next on the agenda is just a list of meetings and events and so forth, and I think it's page 48 of our packet today. A couple of things I want to call your attention to, first of all, this week on the 5th is the Black Hills dinner, and I had told them I would be there, but I've had a conflict come up, so I'm questionable on whether I can be there. I've got a family commitment that may take precedent. But is anybody else planning to attend that? Larry?
I turned in a
Okay.
RSVP.
I have a,
So we'll have representation there, and hopefully maybe somebody from staff can be there as well. That's on the 5th at 5 o'clock. I started to say 5:30, but at Barron's. Second is it's on the screen, is on the 19th of October, and that's when I'm at KAC. But I would appreciate it if any commissioners can attend the chamber breakfast that morning, and Robert or Dory can turn in your reservation for that. The city is giving the state of the city address that day, and I just think it would be good public relations for us to have a presence. And I know Robert normally tries to be at those breakfasts, but have a presence of a commissioner or two just to be present for that presentation. But that's at 7:30. They start serving breakfast about 7:10, 7:15, and you're out of there by 8:30 most often. And then, as I mentioned, I will be at Kansas Association of Counties, and that starts on Monday morning, the 17th of October. So I've asked Larry to sit in as chair of the next meeting, And I think, Robert, you're still planning to attend KAC, so Larry Dory will get a hold of you as far as planning the agenda and so forth for that meeting, but it'll be up to the two of you to get that set. Well, you'll be here, yeah, you'll be here before that, so Robert will be involved in setting the agenda too, sorry. Yeah, I was thinking ahead there. Yeah. So then two of you will be taking over the meeting that day. All right, then we get into commissioner reports, and Larry, since I'm kind of looking that direction, let's start with you.
Oh, looking back on my calendar, about the only thing I had some workforce one Zoom calls. One of them I attended, and one of them I didn't. And attended a fundraiser for Stephen Johnson. And that's about all I have accomplished as far as public stuff.
Anything with regard to the workforce thing that's applicable to us?
No.
Okay, all right. Bob?
I think on that topic of workforce, we will have a community-wide session on October 12th. It starts at 11:30. It's at the college, and it'll be focused on educating students as well as involving Workforce One in terms of retraining other people and basically trying to get businesses, et cetera, involved. And certainly we would appreciate any involvement from the county, as the city, the school districts, and it sounds like we've got a nice response on RSVPs so far.
That's on the
On the 12th,
12th.
Wednesday at 12th at 11:30.
11:30.
And it's at a college, and it's at it's not in the endowment room, it's in their front door, if you will,
Second floor of
the
this.
second floor of that front door project. On RHIDs, have we come up with a template that's, after doing the 3 that you're working on, does it look like we have something now that can move a little quicker? Because we've been months.
Oh, I understand, but yes, that's been part of the project, is finding good examples to work off of. And so I think one of the things we've discussed was using Randall as a good test case for us to get our feet wet, really get a good documents that we can use going forward. Because it's kind of a smaller development, has a lot less infrastructure than what may be typical going forward. So it's a good starting point. I've got all of the templates now created, and then so with Randall just plugging in the information and deleting what we don't need because it contains so much less infrastructure. So I believe, Bob, that we'll be able to do it much more quickly going forward.
Okay, good. Sewer District 4, or whatever we're gonna call it on the west side, have we decided to look at it at all? Or are we just gonna not do anything on the west side of town? The more Robert question, I think.
I think that's the one where we had the study done and so forth. At this point in time, there has not been any identification specifically for funding of that project at this point.
Okay, so
I mean, we're looking at potential grant opportunities, but I mean, right now the county doesn't have the funding to. I don't recall what the price tag, several $1 million on that facility.
Would that be initiated with a petition first?
well, I think, we had a developer who wanted to do something out there, and it required wastewater treatment. And so the study was made, as I understand it, and we authorized and paid for that. And then we have the study, and then we tried for a grant, and we didn't get that. Does it just stop there, or do we tell the developer that he needs to go somewhere else because we can't? Or does he understand that we can do this, but here's what it's going to cost? I think we just need to take it out of limbo and either say, we're not doing anything on the west side of town, or yes, we are, but we've got to have this, and this done before we can do anything. I think that's the thing. I guess no answer is an answer. I guess that means no. But I think they deserve at least an answer. And it doesn't have to be today, so. I was going through, kind of cleaning up my drawer, and I noticed that I was on the CIP committee. Does the county have a CIP list? I mean, we haven't talked about it this year. Is it an internal document? Is it something we ever look at?
It is during the budgeting process. The original CIP committee, from what I understand, was set up, established that a departments brought in a grocery list of things that they would like to have and so forth, and then that committee got together and determined that they had X amount of dollars, and then they went through a process of making a determination where they want to spend those dollars. That's what was in place prior to me getting here. As you recall, we changed the budgeting process, and there's a couple of items here that were commingled. One was equipment reserve, one was building improvements, and so they were all lumped into a CIP plan. So let's say if the clerk's office needed a computer and Public Works needed a motor grader, well, then they were all just kind of thrown in the till and tried to figure out. Well, we changed that budgeting process so that we could have an accurate inventory to make a determination of age and utilization and useful life, and then went through the process then, as you're seeing in your budget, of funding those replacement of capital projects on an annual basis. Now, as far as major capital projects that are tied to funding sources, such as the sales tax initiative that was made for the EMS health department, those are things that are funding source specific driven. Jenny Barker wrote another one and so forth. So those are kind of a higher level ones that the commission and or city or jointly say that this is important for our community to move forward with. Now, going back to your question on the sewer district on the west side, we still need to identify a funding source for that to try and move forward, because we're talking about not just a lagoon system, but actually a processing plant as well, which is quite a bit more costly.
And then I would just simply add, Bob, that CIP committee that we used to have in place and used to have board representation on, that has disappeared. That committee has disappeared in deference to the budgeting process taking on that role of the CIP, what the CIP committee was doing
Well, but I think
specifically.
maybe there is a place for that secondary deal that Robert was speaking about that require funding long-term or whatever else, that maybe we should be involved in that one, like the EMS health department, the HVAC system at the LEC, and those other ones, Mansfield Road, whatever else is on that list, so that we do keep them on the list and find out what's next.
Right, yeah. And- yeah, go ahead, Dave.
The kind of the history is interesting because the city had a CIP program, and that was bringing the community together and find out all of the wants and the desires and so on, which they still practice. We decided to make sure that we didn't sound like this is a want list from the community. So instead of calling it a CIP, as we started off, it was a sales tax funded category, if you will. We called it BRMP, Building Roads and Maintenance Program. And with the kind of the promise to the voters, approve this sales tax, and we'll use that to keep our buildings up to date and our roads, and we won't be buying copying machines with it. I'm simplifying here, but And so we had a commissioner that sat with the county administrator and department heads, and here they would come needing the copier, and say, well, that needs to go as a budget item, but your roof on your building, that can be BRMP, so we're gonna put that up here in another line funded by that sales tax. That's what went away under the previous county administrator. That was the way that was run. I think Larry served on that too for several go-arounds. And if that concept was important, then we need to talk to Robert about reinstituting it as the budget's prepared. But that was how that all fit together.
All right, thank you, Dave.
Well, and then I would add to that, we have in what we just approved today, under our intermediate, that we have CIP projects that we're identifying and so forth. So I don't think we've lost sight of it. How it's being done is a little different than what we've done in the past, so.
But from what Robert said, CIP is no longer kind of in our purview. It's now in the budgeting and the department head purview.
Well,
As
it's
it
in
relates
both.
to,
As
as it relates to equipment, and some of the minor, facility improvements, roofs and that, so we're trying to accommodate it within the budgeting process. We still have not taken away from the aspect of the BRMP fund, for major projects on that.
Anything else? Oh, go.
Well, serving on that, there's some real inefficiencies in that process because we weren't, we were replacing computers over here and we weren't over here, and these weren't as out of date as these over here. And so it led to a lot of inefficiencies that I think where we put it back in the budgeting process is a lot better deal.
Yeah. Keeping it in our priorities, putting it in the budget process, I think was the right thing to do. But anything else, Bob or
No,
Larry?
thank you very much.
Dwayne, any report from you?
2 meetings, convention visitors visited about their budget and the revenues that are coming in, and they're under budget for expenses. Revenues seem to be coming in like they're supposed to, so happy bunch of campers there. Great Plains had our annual meeting, or monthly meeting, I should say, and went through quite a list of potential users of the Great Plains service, and those folks are keeping busy. I think there's five on staff now, where there was 3, what we used to be. So that's moving along, and then some discussion on the annual meeting that's coming up that we were informed of earlier. That's it.
Dave?
I don't have much, Mr. Chairman, to report. Had a library board meeting, which was a rather ordinary meeting, not any great big developments there. I happen to belong to Rotary, and so last week on Wednesday at lunch, had a table mate, the Secretary of State, Scott Schwab, had an enjoyable visit, and I want to report to you that he was sharing with the folks around that table that Finney County's election system and our county clerk are some of the best people in the world, and he was highly appreciative of what Dory and her folks do out here, and use it as a model. So, and then he told me he was coming over to say hi to her before he went to the dinner down at Ulysses. So, and she said he stopped by to say hi. So that's great. Also, Governor Kelly was to make a little presentation out in Chapel Heights, and I went out and I stood and looked and visited the lawn for an hour and a half. She was away late, and I finally gave up and went home. So I guess she showed up. So anyway, that's all I have.
I'll just start with that. I was there at Chapel Heights. She was an hour and a half late, and she was making me late to get to Ulysses for the dinner, so I didn't say much to her, but I did say hi. And then Mike Beam, the Secretary of Ag, was there. I visited with him more than I did with the governor while she was off with some of the builders looking at the projects. And the purpose of that was to help her understand and her administration understand how important our HID is to our rural communities in western Kansas. I did attend a home products dinner, and as that event, it attracts many legislators, especially in an election year, and the governor was only 30 minutes late to that, but she made it to the home products dinner as well. But several other people who are up for election, such as Stephen Johnson and others, were in attendance at the home products dinner. And I just want to simply say this: that home products dinner is an amazing event. This was the 59th year that it started out with a legislator and handful of people 59 years ago, and they had over 700 at the dinner this year, and all the products each year are grown in Grant County, except for this year. With the weather conditions, they had trouble with their tomatoes and so forth, and so they had to have some surrounding counties, I think Stevens and maybe a couple of others, chip in on some of the food. But the Milo donuts were great as usual, and it was quite an event, and it's just a great place to see other people. Jim Minix, legislator from Scott County, a number of folks there that you don't see often. It's just a great place to keep those relationships going. The other couple of things, I did attend the chamber breakfast, as did Robert, this past month, and we were impressed. The school district was the presenter, and we were impressed with their, what do they call it, career and something area, and the two people who presented were talking about the different things that they're doing from a technology, workforce, career standpoint. And the thing that probably was most impressive to me was the fact that it's kind of like this document we approved today. They are not static. They will change. They will take programs out. They will put programs in based on input from the community. And so that was probably the point that caught my attention the most. And I don't know if, Robert, you had any other observations about that presentation, but I was very impressed with and I knew they were doing things like that, but I even learned more from that presentation the other day.
Yeah, as a result of that, we went ahead and reached out to the school district a couple of times now. We'll be getting to set up a meeting to schedule having some of their students come in and do some shadowing and so forth, and giving them opportunity to see some of the various avenues that they could take at the county if they would be interested in it. So stay tuned on that. We'll try and have something yet within the next probably 60 days.
And shadowing and mentoring were two of the points they were trying to make, and that was part of the reason they wanted to make a presentation to the chamber group. Was their plea was for businesses to get involved more than what they are today with regard to the mentoring and shadowing aspects of workforce. So it was really an educational presentation. It was good. And then last week, while I was in Kansas City, I made a trip to Wichita because I was asked by KAC to testify in front of the mental health beds interim, or I don't know if it's interim committee, but a committee. And Senator Bellinger and others are on that committee. Senator McGinn chairs the committee. What I found out was their focus was primarily on additional mental health beds and the facility that's being proposed for Wichita to help alleviate some of the pressure on Osawatomie and Larned and the delays. But I was asked to speak as a commissioner, and what does it cost our county and so forth. But I want to just highlight how I opened with that, and that was that I believe that government starts with local. The government closest to the people is the most effective government, and when we need assistance, that we go to the state and to the federal, and this is one of those times that we need state assistance. We need state assistance with regard to helping our jails out, with regard to the beds that are being taken with mentally ill in the jails, juvenile detention center and so forth. And they had hospitals testify, they had law enforcement testify at that committee meeting. So they were coming in with big asks of millions of dollars. Mine was just assist us when we need assistance. And then Jay Hall did a broad KAC testimony as well. And then lastly, just to highlight, Bob's already mentioned the October 12th meeting for workforce. If anybody can be there, I'm scheduled to still be out of town on the 12th. And I probably will not be able to be there, but I'll know here in a few days. And then on October 20th, the annual meeting for Great Plains Development, if people can attend that. I don't remember the place now, but
It's at the Old Country Club.
oh, okay, at Dodge.
Oh, I thought you Garden City.
Pardon? Oh,
On the,
Yeah, that one wouldn't happen.
that's something else.
Yeah, go ahead, yeah.
I think I'd be remiss, several of us staff, 3 of us commissioners attended the official groundbreaking for the
Oh, yeah.
Western Kansas corridor, and that's a really nice recognition that project's finally officially stirred dirt, so.
It's a big piece of dirt.
It's a lot of dirt.
And there's a lot of dirt moving up.
And Bob did a great job speaking on behalf of the county. Appreciate that, Bob.
the October 12 meeting at 11:30 at the college. Who does the RSVP go to?
Economic development.
Okay.
Anybody else? Anything for the good of the order? Anything I've missed? If not, we're adjourned until October 17th.